Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 12 additional deaths due to COVID-19. A male in his 30s from Interlake Eastern Health Region. A male in his 50s from Northern Health Region. A male in his 50s from Southern Health Santé Sud, linked to the outbreak at Menno Home. A male in his 70s from Winnipeg Health Region, linked to the outbreak at Golden Lynx Lodge. A female in her 70s from Southern Health Santé Sud. A female in her 70s from Southern Health Santé Sud, linked to the outbreak at Fernwood Place. A female in her 80s from Winnipeg Health Region. A female in her 90s from the Winnipeg Health Region. A female in her 90s from the Winnipeg Health Region, linked to Maples Long-Term Care Home. A male in his 90s from Winnipeg Health Region, linked to the outbreak at Golden Lynx Lodge. A male in his 90s from Southern Health Santé Sud. A female in her 90s from Southern Health Santé Sud, linked to the outbreak at Menno Home. I want to extend my condolences to family and loved ones and caregivers. Again, these are not simply numbers, these are Manitobans. And really just a reminder to the critical situation we find ourselves in at this time. Our current 5-day COVID-19 test positivity rate is 13.1% provincially, 14.9% in Winnipeg. 368 new cases of the virus have been identified, taking our total lab-confirmed cases in Manitoba to 17,751. The total number of deaths due to COVID-19 is 353. Due to a data error, one death that had been reported earlier has been removed. This case was a female in her 60s from the Winnipeg Health Region. I can confirm that this was a data entry error and that this was a case, but is recovering at this point. I certainly apologize for the error. We have our systems in place to be able to pick up on errors like this, and so certainly remain confident in the information I receive and report. Our message is unchanged. We cannot sustain these numbers on an ongoing basis. It's putting too much strain on our hospitals, on our ICUs, on our healthcare workers. We're losing too many Manitobans, so we need to bring these numbers down, and we know exactly how to do that, and we've been doing that, and that's to stay home as much as possible. Go out only for essentials. When out, follow those fundamentals, wearing a mask, physical distancing, staying home when ill, but really not to socialize with people outside of your household. Now is the time we need to just stay home and focus on reducing our amount of contacts, and we'll start to see these numbers come down. The only way to achieve this is if we work together and all do our part to bring these down. It includes individuals, includes employers, and just all Manitobans. We need to work together to continue to bring down these numbers. We know that these is putting too much strain on our capacity in the healthcare system. The numbers are too high, and so that message is clear: is to stay home as much as possible. We need to bring down our contacts, and we'll bring down these numbers through that approach. So thank you, and I can open up to some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from City News, Jonas.
Good afternoon, Dr. Roussin. Just browsing through the data here, and it looks like the test positivity rate in Winnipeg is rising again. Just your thoughts on this number over the last little week and what this shows us.
Yeah, well, certainly the test positivity and the just the absolute numbers are too high. We can't sustain this, so we need to continue to do to follow this public health advice, to stay home as much as possible. We need to bring down these numbers. We're going to see daily a fluctuation of these type of numbers over time, but we really need to have that concerted effort to bring down number of contacts and subsequently bring down these cases.
What does this number tell you right now about the situation in Winnipeg, sir? If you don't mind expanding, I know we need to bring down contacts, but the fact that this test positivity rate is rising again, despite that we are under strictest measures yet.
Yeah, again, so it's relatively short term, so it's hard to make a sense of the trend. Certainly, our overall, absolute numbers have not been escalating. So we know there is an effect from our restrictions. So absolutely the intent was to bring down both the absolute numbers and this test positivity. So we're not seeing that. So we need to ensure that these public health measures are being followed. And we'll continue to watch very closely.
From CHVN, Taylor.
Hi, good afternoon. When it comes to the unsheltered population, are you seeing those cases rising or lowering right now?
Yeah, we're still seeing that they're disproportionately affected. So we're still in the Winnipeg region for sure. We're seeing a disproportionate effect in the sheltered or underhoused population, the lower income quintile. And so a number of measures are being activated to try to address that.
Are you able to share what some of those things are? I know Homelessness Winnipeg says that low barrier housing will be a very effective tool when it comes to helping the unsheltered population during this pandemic. But are you able to share other things that the province is doing?
Yeah, and so sort of the work that public health can get involved in is the expansion of the alternate isolation accommodations. So for the people who are requiring isolation and even some added supports while they're isolating. So we've been able to expand that. We're working on rapid testing in the area so that we can have tests back immediately to be able to isolate cases that might be more difficult to find later on, and again can do some contact tracing at that time. And we're looking at other supports for people who are self-isolating, easier access to supplies, to food, while we're asking people to self-isolate. So a number of fronts we're working on.
From the Winnipeg Free Press, Danielle.
Hi, Dr. Roussin. We heard from the Premier earlier today about new testing initiatives rolling out in January for teachers. When it comes to testing of folks for COVID-19, why hasn't our strategy evolved much over the past recent months to support better data collection and analysis to manage the epidemic?
Yeah, and so the approach to testing, the number one approach should be testing those at highest risk of having the condition. And so we've always focused predominantly on symptomatic people. And so that's going to continue to be our focus. And so we definitely, there's a limitation, right? There's worldwide demands on things like the reagent. And so we're limited on our overall testing capacity and in line with pretty much every other jurisdiction. But now there's more and more access to rapid testing. And so we're going to find ways to incorporate that now into our testing strategy, and you've heard a few of the examples.
Okay, thank you. We also, here at the Free Press, we've received reports that the time to get a test result in the Portage-La Prairie region, it has surpassed 10 days. And with word of that spreading, that testing doesn't return a quick result, people are also hesitant now to go get swabbed. So why are test results taking so long in that area? And can you tell us what the current wait time for a test result is provincially?
Yeah, well, I can take a look at it. I think the overall test turnaround time, the median is, I believe, about 55 hours. And so I'd be surprised if that was a routine thing that was happening in that area, but we'll definitely check on it.
From Global, Marnie.
Good afternoon, Dr. Roussin. Marnie from Global. We're hearing of extremely high test positivity rate in Shamattawa First Nation. I was just hoping you could confirm what the situation is. We're hearing of a test positivity over 50%. Just hoping you can confirm what the situation is in that community currently and what more support they might need to help get it under control.
Yeah, so the community is currently experiencing an outbreak. For the details, I'll ask you to speak either with the community or to FNIB on that. But certainly there's an outbreak in the province where we're involved and seeing what further supports can be offered.
Okay, and you mentioned their absolute numbers aren't escalating. Last week, I believe you talked about the number of contacts per case coming down from an average of 7 to about 4. Have we seen that decrease any further, or are you seeing any other signs that these restrictions are doing what they're supposed to be doing?
Yeah, and the last rough numbers that we've been looking at with contacts per case, again, the median is coming down, and it had been at 2. For some time, and so I think it's we are seeing that effect of it. Again, that's a large range. For people who are self-isolating, their number of contacts, many of them are 0. But then, of course, we'll see some higher numbers in that range too. But the median is at 2.
From the Brandon Sun, Michelle.
Good afternoon, Dr. Roussin. My first question is from a reader. In a community setting where Code Red applies in public areas, what is the responsibility of management to ensure that Code Red mandates are followed?
So this would be in a common area of a shared residence of an apartment block, or is it?
I'm not entirely clear on what she means, but I would say, what is the responsibility of a person in charge of a space that would be communal?
Yeah, well, it kind of depends. Like I think if we're talking about a retail store, then they're certainly responsible for the occupancy numbers. They're responsible for reminding people to wear masks, but they're not responsible for ensuring people wear masks. Much would be the same thing in these areas. We should the group size limit should apply. If it's an indoor public place, then masks should be worn, and so the requirement from somebody who's responsible for the area would really be to remind people that they must do it. So it kind of depends on the specifics.
My second question is, are you satisfied with how COVID-related vaccine preparation is evolving?
Well, I mean, it's this is the fastest that the world has ever been able to get a vaccine together for a novel pathogen. So it's really, if you look at the typical time frame from getting a vaccine developed and approved and starting to be administered, this is quite the feat. So from that perspective, I think we're all quite happy that we have vaccine on the horizon. Of course, there's going to be difficulties and early low numbers, low quantities to start vaccinating people with. So we have to make choices. We have to find those priority groups. Of course, there will be people who feel the priority groups should be different than what they're going to be named as. So, but overall, I think it's been quite a feat to be able to really think that we're going to start immunizing people in the relatively near future.
From CJOB, Shane.
Thanks, Dr. Roussin. The federal government, speaking of vaccines, says we might have that vaccine and then approved in as little as a week. I'm just wondering how discussions are going with the feds and when Manitoba can expect to see their first deliveries and how many doses we might be expecting.
Yeah, and so we're at multiple levels in discussion with the federal government on the procurement and soon distribution of that vaccine and the allotments that each of the provincial and territorial governments will get. So ongoing discussions with that. Times, we still don't have definitive times as of yet. We don't have an approved vaccine yet, but hopefully that's very near on the horizon. So we'll have some more information on that hopefully shortly.
Okay, thanks. And then the Premier also mentioned something called super centers for the distribution of the vaccines. I'm wondering if you could tell us a little bit more about that. I'm wondering, are people going to have to travel? I'm thinking remote communities and stuff like that to get to these vaccines, or what's the plan? Sort of, what's the maximum distance you'd like to see people have to travel to get these vaccines?
Yeah, and so we're still, we don't have all the details ironed out. We'll certainly, this is going to be a mass vaccine campaign, so we're going to have mass clinics, in certain places. You're probably aware of some of the logistical challenges for these vaccines that to be stored at very cold temperatures, so that makes it logistically more challenging. But I would say, overall, we're looking to be able to widely distribute the vaccine, but it's not going to be as simple as a typical vaccine campaign. But we're still working out the details.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Scott Billick, Winnipeg Sun. First question. I guess there's kind of some hesitancy around whether we're still making progress within these restrictions. Is it fair to say progress is being made at the moment with our, record high hospitalizations, and we tied a record today for most people in ICU? At least Winnipeg's test positivity rate is up, and I think we're at 9 straight days now with double-digit deaths. Is it fair to say we're making progress at this point?
It depends on what you compare it to, right? The modeling that we were looking at, the trajectory that we were at when we put these in would be much worse than where we are now. So from that aspect, the restrictions have had an effect. The ICU admissions, the hospital admissions are all, a lag, right? So those are things that have occurred days to weeks ago. And so certainly the results of the daily cases will lag behind, further for the severe outcomes. But we're certainly not where we want to be, right? So that's no doubt. We want these numbers to be much lower than they are. We wanted them to be lower than where they are right now. But we're still looking for them to be on the decline. We wanted this test positivity to come down, right? So test positivity, not only will, be a clear indication of the absolute amount of cases you get, but it also puts a lot of strain on our lab services because it makes pooling much more difficult. So there's lots of reasons that we wanted both of these numbers much lower than they are right now, and we'll continue to strive for that.
Thanks for that. In court today, one of your public health orders has been challenged. You have a law degree. I guess what do you think? I suppose about a church is taking a public health order, designed to, in your words, to save lives, into the court setting.
Yeah, so, because it's in the courts, I'm not going to be able to comment on that. So, maybe we'll have more to discuss on that, but right now I can't discuss that.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin. Gavin from Radio Canada. I was wondering if you could give us an idea of what the proportion of community transmission is among the new cases these days.
Yeah, so I don't have, the breakdown on a daily case. Over the last 7 days, we had roughly about 500 cases that were not linked. And so that's what we would describe as a community-based transmission. It varies through most of the various jurisdictions. At the last rough numbers I saw is that we're probably around 1/3 of cases province-wide that are community-based transmission, but as high as 50%, say in Winnipeg.
I know you were asked about this before, but just on a specific way that Brian Pallister was speaking about the vaccine rollout, he said that he was concerned Manitoba was going to be shortchanged by the plans he's hearing of, the talk he's hearing of from the federal government. Are you concerned that Manitoba is going to be shortchanged when the vaccine does roll out?
Well, it's going to be is a challenging time, right, where the quantities are going to be low, at least at first, right? We're going to eventually get to a place where any Manitoban who wants the vaccine is going to be able to have it, but at first quantities are going to be limited, and so we're at multiple levels working with the federal government on procurement, et cetera, but I don't think I would. I'm going to comment further on that. I think we're working to ensure Manitobans are going to be able to start benefiting from this vaccine as in line with other Canadians.
From CBC Manitoba, Bart.
Hey, Dr. Roussin. So in Alberta, they've warned people that looks like most Albertans won't get their vaccines until the middle of 2021, and maybe not till later in the year. Can you set Manitobans' expectations accordingly?
Yeah, I mean, I think that's probably in line with what we're anticipating right now. Of course, things change, but like I say, in the early parts of this campaign, we're going to have limited quantities. So we're going to have to focus on those that are high risk, those that are high risk to exposure or to spread to those that are high risk. But ultimately, we'll be working at the vaccine campaign probably well into a year. Moving forward.
There's some suggestion that Canada is way at the back of the line in getting the vaccines. It's ordered enough vaccines for doses for all Canadians 9 times over. But there's some analyses that suggest that the supplies are really going to take until later in the year. And I know you're up on this. How concerned are you that we're really only going to see a trickle until later in 2021?
Well, I think there's obviously going to be worldwide demand on these vaccines. They've been approved or being approved in some places and manufactured at rates we've never seen before. And so I think that we would all like to have widespread community coverage as soon as possible. But I think there's going to be a lot of demands on these. I think worldwide it's hard to know, but I think Canada will likely fare well in comparison to other nations on the rate at which we receive vaccine.
From CTV News, Stephanie.
Hi, Dr. Roussin. We've been hearing some concerns from parents that they're not able to go into like a dollar store, for instance, to buy school supplies. And now that we have remote learning coming up in January for many students, is the province looking at potentially adding school supplies to the list of essential items?
We're looking at a number of things. As you know, that these current public health orders will expire on December 11th, so we're working right now on what the next set of restrictions will look like. There's no doubt from these numbers that we will need restrictions in place, but we're reviewing a number of things on how they may be different.
Okay, thank you. And just another question is, why are teachers being prioritized over personal care homes for the rapid testing?
Yeah, well, this is just one pilot. So this was this relatively new to market rapid test device. And so it's a pilot. We're going to start on teachers. We have other sort of pilots in the works. And so we'll update people as we get them going. So this is just one of many steps that we're taking.
From Reuters News Agency, Rod.
Hi, Dr. Roussin. Can you provide a rough idea of how much of the northern population you're planning to move to other communities for vaccination? And just what kind of health issues does moving large numbers of people in a pandemic present?
Yeah, so we don't have such plans at this point. I think for the most part, we're going to try to get vaccine to the people rather than moving a large amount of people at one time. But it will largely depend on on logistics and on just on the sequencing of how we roll this vaccine out. But we don't have any plans as of yet of moving large amount of people.
And can you provide a test positivity rate for northern Manitoba as a whole, or if not, just identify sort of the range of rates that you're seeing in small northern communities that are seeing these outbreaks?
Yeah, and so, remember the test positivity, the lower the denominator, the more variability and the less reliable it is. And even in the northern health region, the test positivity rate is, again, more difficult to rely on. It's going to have a lot of variability. So we don't report or regularly report that. So it's, about 14.9% in the north. But again, we can't put a lot of weight on the lower denominators.
Thank you, Doctor. We have time for a few more questions this afternoon. Please proceed.
Hey, Dr. Bartley Kivas here. Just to clarify some questions that Scott and I asked you about yesterday. It used to be a school outbreak was classified as 2 students. What is it now, and why did it change?
Well, I'm not aware of it changing. It's if the 2 students, if there's a transmission within the school, we would usually determine that as an outbreak, right? So again, the definition of the outbreak is to help public health investigate and ultimately apply a strategy to it. So the decision to declare an outbreak is with public health. But I'm not aware of any real change to that, but we would need to see transmission. Would think about declaring an outbreak.
Can you, it's Michelle from the Brandon Sun. I'm trying to square something in my own mind, and I'm certainly not a scientist. But I was looking at some of the historical record at the 1918 pandemic, and by the second year, by summer, things were mostly over, and now we're talking about a vaccine that may not be able to be rolled out until completely until the end of next year. So how does a person sort of square that?
Well, these are different viruses. All right, so this is a coronavirus versus an influenza virus. We're not seeing, rapid, genetic change in this virus to make us think that it's going to just go away. But we can't predict the future. We have our second wave now. There could be a third wave next fall. We have to prepare for that. But this is the first time, really, certainly in a coronavirus pandemic, that we have access to a vaccine. And so we're going to get that vaccine rolled out to those at highest risk, even though we might not be able to get the rapid population level coverage we would like to see to start benefiting from herd immunity. If we can vaccinate those that are most at risk, that's going to have a beneficial effect on our case fatality rate, on our hospitalizations and ICU admissions. So there's a lot of benefit to getting this, whatever vaccine we can get into arms early on. And then as we get more and more access, we want to have that population level coverage to ensure we don't see a major third or fourth wave.
Okay, thank you.
Dr. Dr. Roussin, it's Shane from CJOB again. This is the second time you've had to remove a death from the list due to a data entry error. I'm just wondering what exactly is leading to these errors and what's being done to keep them from happening again.
Yeah, and so we review these things, and obviously we were able to correct it. So we have processes in place to, to reduce the amount of errors we see, and also to be able to go back and correct them as we find them. But remember, these all of this reporting is happening very quick. Right from the beginning of this, we wanted to keep Manitobans up to date to try to provide these numbers as real time as we can. Normally, when epidemiology is working on reports, they triple check and can have weeks to review reports. We're doing this day in and day out, 7 days a week. So there's going to be some errors like this, but what's reassuring is we have a system in place to discover them and then correct them.
Hi, Dr. Roussin. It's Stephanie from CTV. Just with remote learning coming up, and with yesterday it was mentioned that transmission rates, there's evidence to suggest they're higher for the older students. So why not start remote learning before the break? That way students aren't going home and infecting their families if they do end up having any gatherings over the holidays.
Yeah, and so these are all things that we've bounced back and reviewed various options. Again, it all comes down to despite the increased risk in the older kids compared to the youngers, the overall risk is still relatively low. We're not seeing a lot of transmission within schools, and we know we get a lot of benefit from having children in schools, face-to-face learning. And then we thought that we'll take advantage in some way of the natural break and apply that remote learning after the break because we know it's going to be a very challenging time. We know that there's gatherings that will likely occur, and so we'll try to give an incubation period over that after that occurs. So that's really the thought process.
Dr. Roussin, Bartley Kivas here again. We spoke yesterday about the increased capacity that's available because of the lower usage of the swabbing capacity. Why not, with that capacity, swab or use rapid tests for all residents and staff of personal care homes once a week or twice a week? Because we're down about 7,000 test usages a week. Why not use some of that capacity in these truly most vulnerable areas?
Well, we do look at those type of plans, and remember there's some limitations or a lot of limitations with routine surveillance. Although we are working on some pilots to be able to do some of this, I think that's a tremendous amount of testing capacity to be able to test all residents, all staff, weekly or bi-weekly. And it's difficult to know the exact impact of that. So we are working on strategies. We certainly don't have enough rapid tests to do that regularly, but we are looking at an approach to do a pilot in these areas. So testing capacity is somewhat limited. We have the swabbing capacity, but we also need to ensure we have enough capacity at the lab now that they're unable to pool samples. So there's a lot of things that go into this. So it's hard to make just quick maneuvers like that, but we are looking at a number of fronts on doing more routine testing in those personal care homes.
And on that note, this might be too technical a question here, but go ahead, Danielle.
I just wanted to follow up on what's happening at the laboratories to increase capacity where we know there's a limit there.
Yeah, and the biggest limit is on the reagent, and that's a worldwide demand. So every jurisdiction's in the same spot on that, and so we're working on various things. Are there other platforms we can use? Can we incorporate more rapid testing, which doesn't use that same reagent? So there's a lot of work there, but the biggest strain is that worldwide drain on the reagent.
Hello? Dr. Roussin, I don't know if, can you hear me right now?
Yep.
On that note, there appears, I was watching a presentation about our laboratory operations here, and I read a little bit of a technical paper I only understood part of, but it sounds like there's a group purchasing issue that prevents scaling up here because of the different machines that are used at CADM and the different ways that Dynacare does things. Can you comment, is there a strategy now to sort of pool the resources of those various labs and machines to be able to scale things up? Because it sounds like it goes far beyond reagents.
Well, it does go beyond it, right? I mean, there's the human resource capacity, there's other lab issues. Right now, there's certainly the specimen collection. Right now, we've done quite well in the specimen collection. But a lot of it is the allocation from the manufacturer of the reagent. And they do that at the provincial level. So whether you have one lab doing it or 12 labs doing it, you're going to get your provincial allocation of that reagent. And so we are looking at various ways to try to broaden, the scope, but that's the kind of thing we're dealing with.
And also yesterday, Dr. Arlen, or 2 days ago rather, the Assembly Manitoba Chief, Arlen Dumas, the Grand Chief, said that the Premier's mistaken when he talks about vaccine allocation to the north because so many Indigenous Manitobans are living off reserve, and especially in the Winnipeg area. Is it accurate to say that the vaccine distribution to Indigenous people in Manitoba may not be as complicated as the Premier hinted at on Tuesday and today?
Well, I think what's going to be very complicated in the rollout is that we're going to be receiving relatively low quantities. So we're going to have to find ways to prioritize. And so which groups are a priority for it? We know there's lots of groups that should get it, but we're unlikely to receive enough quantities to be able to do all the priority groups at once. So we're going to have to sequence it. And then, of course, it depends on the provincial allocations of this. So there's a lot of moving parts right now. And so we're going to have to really see what sort of distribution we receive, and then we'll have to prioritize it.
What do you mean by sequence?
Just a sequencing of it, right? Like we're not going to receive just all of our Q1 doses all at one time, and then we just give it to everyone at once. We're going to be receiving, likely small quantities over, weekly or every couple of weeks. We're going to have to decide who gets it at what time.
What's your communication strategy going to be on that? Because there's going to be a lot of Manitobans. Premier is correct. Everybody's going to want that thing. What's the communication strategy going to be when you are, in effect, rationing out doses at the beginning?
What makes it really challenging, so I mean, our communication strategy is going to be as transparent as it can be. That, this is the amount of vaccine we're receiving. This is the priority groups we want to give it to. This is how many is in each of them, and this is the sequence. And so it's really tough to right now communicate that because we don't have a for sure quantity that we're receiving, when and how. I mean, we don't even have a vaccine that's approved yet. So once we have all that, then we're going to try to communicate very transparently, and there'll be no doubt people who will be maybe in the second batch that felt they should have it in the first. So we're going to try to do our best to do it based on the evidence.
Hi, Taylor from CHBN here. We have all of these restrictions in place. Why is Winnipeg's test positivity rate still rising?
Yeah, and so that wasn't what we were wanting. By this time, we wanted to see the absolute numbers come down. We wanted to see the test positivity come down. Of course, if you look at our modeling, without the restrictions, we would be at a much worse place. But I think if you look at the jurisdictions around the world, around Canada, we're in the second wave, and the second wave is turning out to be, more severe than what we saw in the first wave. There's lots of reasons for that. The time of year it's being hit, and so we're we're still looking to get these numbers down. We still message to Manitobans that the best way to do this is to stay home as much as possible, reduce our number of contacts, and we'll continue to see some progression.
Thank you, Doctor. And this concludes today's media briefing.